either the state or the local government or
the people, we're going to have to pay because we are the state and the local government. It's our money that runs these
and that if we provide the kind of resources that are necessary to provide education and those other small things that might be able to prevent this kind of destructive behavior, that it's cheaper per child to do it at that level than to wait until that destructive behavior becomes a pattern, and then to try to deal with it after underweight infants, child abuse.
Mothers who are set in those cycles and they continue to have children. Aaron Shirley, who's a good friend of Dr. Foster and who lives in Jackson, Mississippi, has an excellent school-based health clinic at Lanier High School. And the children get all kinds of health services, all the services that they need. And he has really cut teenage pregnancy out in that school. And that was one of the schools with the highest number of teenage pregnancies before he entered on the scene. And so that's one thing that can be done.
And so there is actually a documented
it's been on 60 Minutes and everything.
Of what can be done if we're willing to do it. Now, I think another problem that many people complain about is that the school-based clinics, and I think that that's what you're talking about primarily, the school-based clinics have not been given the adequate leeway to really do the kinds of things and to say the kinds of things that are necessary in order to prevent this kind of destructive behavior. Now, what are your views in reference to that? Because I think you've already indicated that there is a possibility that it can be done. Do you find that the schools are not school-based clinics are not performing as they should?
Well, there are very, very few school-based clinics, and the majority of the ones that I know about performing as they should, except some of them are not allowed to give out birth control information or devices or equipment or whatever, and that's another program.
Well, and of course it might be, but if they are prohibited from giving out that kind of information, and it seems that the young people that are part of that population are the people that are, for the most part, involved in that kind of destructive behavior, then are they really performing the kind of mission and the kind of responsibility that they perhaps could perform? In other words, are they doing all that they possibly could do?
Well, I do think that the children need the information, but I'm not sure how I feel about pushing certain kinds of contraceptives on young children. Like I'm not in favor of the birth control pill being given to 16 and 15-year-old girls.
And that is
because of what the steroids do to the system.
And that is a problem that in one of the discussions that is generally a part of school-based clinics and some of their activities within this area.
But I think it's ludicrous not to provide condoms to children who are engaged in sexual activity.
And so
especially with the AIDS pandemic that's going on.
Well, now, how would you fit AIDS into this as a problem? And of course, I know that young people are as susceptible to the AIDS virus as anybody else. And when we talk about teen pregnancy or adolescent pregnancy, are we talking about a large population that has contracted either the HIV or the full-blown virus? And if so, do you have any information in reference to how that is happening? I mean, what is the relationship between teen pregnancy and AIDS?
Okay, we know that the incubation period may be as long as 7 years or more. And we know that a large number of people with that are infected with the virus are in that young adult age group, 24 to 34. So if they were infected with the virus 7 years ago, that would have to mean that they were infected as teenagers. And I think we're looking only at the tip of the iceberg today. And I think that in the next 5 or 6 years, we're going to see many teens
who have now become mature adults who will now be affected by the HIV.
Who will have AIDS or who will be just HIV positive. And young people are doing so many different kinds of things that can help spread the virus. For example, you have a lot of young fellows who participate in sports who pop their thighs with the needles, and they share the needles, and they're doing this when they take steroids.
And so not only is the abuse of illicit drug, of course steroids I think has also been declared an illicit drug, but generally we think in terms of crack and heroin and cocaine and all of those things as being the road by which the needle is shared and people contract this disease. But now you're saying that even those folks who are not involved in these well, all of them are destructive illicit drugs.
But it's something that we as a society don't think about as being destructive behavior. We look at the football player who has big muscles, and we don't think that he may be HIV positive. And he could have gotten it from sharing the needle.
And that there is a possibility of getting it through that source as well as some of the other sources. And I think that that's very, very interesting because I think that in all of the conversations that we've had, very few people have mentioned the fact of steroids. I think that this is the first time that anybody has ever mentioned the possibilities of the abuse of steroids as being one of the roads that might lead to HIV positive performance or whatnot. And I think that that's quite interesting.
Many of the athletes are in a denial now. They're saying, oh no, we don't do it. But I can't remember the name of this athlete who's dying now.
Lyle Alzado.
That's right, and he's confessed that he's been taking them for, you know, several years.
And you think that that might be general with our young athletic population?
It's in epidemic proportion among young men.
And the more it becomes involved with young men, the more it will impact or affect our young women. Very good. Okay, we've got about a minute, Dr. Ellis, before we end the show for today. Do you have any final or any parting comments in reference to this as a real problem?
1 million teenagers are at risk. 1 million teenagers. That's 1 in every 10 child will get pregnant.
Very
that's
good.
An awesome number, and that's something that we really need to think about, and these children are our future.
Very good. And let me thank you, Dr. Ellis, for coming by and giving us that very, very important information this morning. I'm sure that our audience has a better idea about the real problems involved in adolescent pregnancy. And let me encourage you to tune in again next week for another informative edition of Comments. Good morning.
Forced to sell at the John F. Lawhon Building. New